first speaker, Dr. Gopala Krishna. Welcome, sir. Let me introduce you. Dr. Gopala Krishna started as a medical doctor and credits meditation for his transformation into a spiritual scientist. His organization, Spiritual Tablets, is committed to fostering individual holistic well-being using meditation as a tool for self-healing. His experiences with meditation and interactions with Patriji led him to include meditation in his patient care. His numerous projects included Meditation Health Clinic, which provided meditation training to patients, and Pyramid Spiritual Health Care at Nizam Hospital, where patient treatment included a plant-based diet, meditation, pyramid power, and spiritual health counseling. This research culminated in a holistic healing approach that characterizes spiritual tablets. Welcome, Dr. GK. Over to you.
Thank you. Thank you very much, madam, for a nice introduction. And welcome all the delegates and masters and Brahmarshi Pitama Patriji for this great platform and Buddha CEO Foundation. I am very happy to give my short presentation on prevention is better than cure. And welcome to the GCML conference, the regional conference in St. Louis, USA. Currently, I am connecting from Manchester, United Kingdom. Even though this proverb looks like very simple and well known, today I am trying to explain this concept or this proverb in view of the spiritual science and meditation, so that the leaders and the people and the organizations can understand how we can give a better healthcare to the people. So the early diagnosis and early treatment, they will reduce the risk and potential irreversibility of the disease. Usually, by the time the disease completely sets in, it will be in a very acute condition, which really needs a lot of effort to cure it. So that early diagnosis is very, very important, that we know very well. So a research on the Alzheimer's disease, why we need the early diagnosis. So that paper done in 2019 by Kaya and Jill has clearly quoted a lot of important points, which we used as a base for the explanation and for a creative idea that we are trying to come up with in a spiritual way. So numerous medical conditions, including the chronic and acute illnesses that we are seeing today. So the lifestyle factors like increasing age, diabetes, smoking, high blood pressure, and elevated cholesterol levels, obesity and depression, lack of physical exercise, and low education level, infrequent participation in social gatherings. So all these things are the key lifestyle factors which are there behind any of the major illnesses, which we can identify beforehand. And so these are linked to a risk of any serious illness in general. And moreover, whenever we are diagnosing a serious illness, for example, the cancer, the moment it was diagnosed, immediately the patient God, usually we call it as PZ, patient God, they will undergo a shock. And then a mixture of emotions, including disbelief on the whole life and anger, the fear, of course, will happen, and hopelessness based on the disease prognosis factors. The doctors will explain either they might have go for a lifelong medication or whatever. So all these factors are there whenever a diagnosis was made. These are all of the clinical factors, we can say. And An early diagnosis and a subsequent access to the appropriate services and support can greatly benefit the people. So that's why if we are able to diagnose very early in the initial stages, that will definitely give a better cure, and a lot of things, especially the irreversibility of the disease, can be completely cut shortened. So here, there will be a significant economic burden, and there are three major factors under which we can understand the lack of early diagnosis, how greatly it will affect the other areas. So today we are seeing multi-specialty hospitals to treat the acute phase of the disease. In fact, it is not exactly the acute, which is already crossed certain doors, and then finally they are landing in the hospital. By the time they reach the hospital with a serious illness, and there is a lot of limitations to give a complete cure, and moreover, it is a very big cost burden to maintain those multi-specialty hospitals. Similarly, providing an ongoing support for the residual damage. For example, if you see a kidney failure patient, he regularly has to go for that dialysis things, and a lot of acute exacerbations for every major chronic illnesses. So here, a lot of life compromisation happens. That compromised life one has to accept with that disease patterns. And then the day-to-day care, which is again a burden to the family. So in these three areas can be cut short and provided if we have an early diagnosis and intervention. So these are some of the factors in general in any research study with the early diagnosis and prophylactic kind of things we'll find. Similarly, being a medical doctor, since last 25 years, when I am trying to work with the patient God, with the spiritual principles, by looking at the whole case study, clearly we can identify a certain areas, I can say the Y junctions, where they have crossed that Y junction towards the right or left, and that will automatically create the illness in due course of the time. That is where we are running to the doctors and hospitals. So here, the key principle with which we worked is spiritual intellect is the root and physical health is the fruit. To gain a physical fruit as a health, we need to work on the spiritual intellect. Above that, of course, the consciousness, energy, and wisdom, all those parameters will be there anyway. But the spiritual intellect, once we sharpen the intellect, then we can gain that as a fruit. This is the key principle here. So, either at an individual level to understand the basis of the wellness. So today, the whole presentation lies in this spiritual pathology that I'm trying to present in front of you. Either at the individual level, or at the family level, or an organization level, in a city or a country, you can say, in all these areas, lack of identification of the purpose at an individual level, or the malalignment in the big picture of the organization or a place or the environment where we are living. So put together that malalignment with the purpose and in the big picture, that will automatically generates a certain trivial damages as a reminder, and certain object signs and certain coincidences, some intuitive messages. So all these things we get in due course of time. The person who is spiritually evolved and who are working as, I can say, meditation leaders, they can easily identify, like the doctors identifying an illness with an early diagnosis with certain radiological and medical investigations, blood workouts. So similarly, here also we can identify an illness which is coming on the body as a sudden trauma that can be identified very early. So through soul scanning, we call it as, so otherwise we can screen those people with an inquiry or with a set of questions. So a common set of questions, a common set of observations that we have come up with in this 25 years of research by working on the wisdom principles that we can apply. Even a natural calamity in an area or something happen in a factory, in an organization, initially it looks like trivial, like a mere coincidence, or suddenly it is happened by chance, by fluke. That's what we see. But a meditation leader or a spiritual leader can see the deep message within that. How to set the whole thing, they can understand and they can act based on that. So here, it will allow us to identify the potential reminder. So it is like a potential reminder to understand, to know about the hazard that is going to happen in further ways. In the organization level, we can say it is hazard, but individual level, it can be a reminder on the body in the form of disease. So here, disease is nothing but a physical reminder that we are away from our original potential, our source, our purpose, or a deviation from the original purpose of life. So after identification, if we train them through spiritual modalities, then there is every chance to stop that further progress of that particular disease or the problem or whatever that is going to come. So here, so that we can establish a righteous, happy, and healthy individuals or groups. So in the family members or in a group. So if we work on that, easily we can identify and we can reduce or we can cut short that further damage. So this is the main flow to understand from an individual or a group, and identifying it in an early phase, especially the evolved souls and their patterns in life and in an organization, and so that we can train them in a proper way and we can reduce that cost burden, whatever I said earlier, comparing with the medical system. So to understand this, let me go with a important case study here. It's a 2 minutes testimonial of a most dreaded disease and how we can identify in an early stage to not to land in a traumatic state that we'll understand here.
I am Suresh Chauhan. I am from Bangalore. I got a disease known as myasthenia gravis. It's a neuromuscular autoimmune disease, and normally out of 1 lakh people, only 1% gets it. The muscles of whole body becomes very weak. It started with eyelid. Eyelid were drooping, and slowly the eyes were closed. And slowly it progresses on the arms, legs, and whole part of the body. After some times, even my biting muscles became very weak. It was very difficult to eat. Even I had been to Chicago also for this treatment, where the research is going on. There also it was told, whatever treatment you are having in Bangalore, same treatment we have in America. You have to continue with steroids. There is no other alternative and there is no cure at all. During that time, I came in contact with Dr. Gopala Krishna, who cures many patients by teaching them meditations. So Dr. Gopala Krishna guided me and given me a teacher named Pravina, who taught me meditation. I learned meditation over from Pravina, and she told me you have to do 3 hours daily for 40 days continuously, since it is a very chronic disease. I seriously started meditation 3 hours daily, 1 hour in the morning, 1 hour in the afternoon, and 1 hour in the night. After 6 months, around 20 to 25% of improvement I realized, and even steroids dosage were coming down. Then I had belief that with meditation, this disease will go into remission. Even doctors were surprised, and doctors advised me, you continue meditation daily. And say after 2 years, 90% of recovery I noticed. I was really very happy. My health was improving a lot. Now it is almost 8 years. From 8 years, I am meditating. Now it is a reincarnation of my life.
So here, in this case, when I observed him, of course, definitely like ulcerative colitis, Crohn's disease, so many 1 in 1 lakh or 1 in 10,000 exceptional illnesses. Today, we are getting wonderful results with meditation and counseling and wisdom sharing. But when I look into these kind of histories, there is a clear-cut failure to fulfill his passion. he has a strong desire to write a historical related book comparing so many histories of different worlds. And that was long pending because every day he is totally loaded with his commercial job. He is a Hindustan, some company drug distributor. Loads of lorries of drugs, medical drugs will go from his house to the entire state. Such a serious work he do. And then there is a failure to balance his spiritual heart. Even though he is an evolved soul, no efforts about spirituality. And then the failure to identify the spiritual identity, especially what exactly he is supposed to do in the community, that part is totally compromised. So these three parameters are the major areas, even though he is thinking, but he's unable to act upon it. And then one fine day, he landed with this disease. 6 months he is on the bed. And finally, today he is zero steroids, traveling across the globe. So many countries he traveled, teaching meditation to everyone. And a myasthenia gravis patient without steroids and happily living means that itself is a great miracle for the medical community. So if we are able to cure the illness, then why not prevent these things by early diagnosis and reducing the damage?
I'm Suresh Chauhan. I'm from Bangalore. I
And now here the keystone is essence of healthcare lies within the communities or individuals rather than establishing a big holistic institutions. Here I'm using the word holistic institution. Today we are bringing very big spiritual premises, even the multi-specialty hospitals, where we think that the real health can happen. But this short presentation is all about giving stress on, it is not in the big hospitals or institutions, it is with the communities and individuals. So the amount of effort should be directed towards the screening and identifying and providing early training to an individual or in a group or in the community level. So the better the early giving the training by screening them, especially the people who are potentially failure in balancing the spiritual part. So the implications are like a little implications with my experience I am giving here, conducting a door-to-door campaigns and with the questionnaires, screening them either in the organization level or individual level with a set of questions or questionnaires, we can understand their stress levels, their failure factors, and they are evolved soul or not, what kind of failures already they crossed, and he is a potential person to get into a disease that we can identify. And establishing community meditation centers. Instead of establishing a big centers, if every village or a town or a place have a simple community pyramid, that itself automatically balances the energy. All the potential people automatically attracted towards that center and they can fulfill their purpose and automatically they can come out of that upcoming major illnesses. So what is the role and responsibility that we need to hold? So at an individual level, I call it as a referral. Whenever you identify a person with a stress, or the meditation leaders can easily identify a person already he crosses certain areas and is a potential person to get into a major remainder on the body. And we need to refer them for a proper training. And at a group level, we can focus on early identification and the training efforts. In the organizations, we can give them a frequent trainings in meditation and spiritual science so that they can correct themselves automatically. And of course, in the government level, whatever I told earlier, the community meditation centers, instead of constructing crores of money, utilizing money in hospitals, one can go for these community meditation centers. So the conclusion is, under the umbrella of PSSM and Buddha CEO Foundation and global, so many organizations today, including the spiritual tablets, effectively operating at the individual, group level, and community level, identifying the malalignments and very early, and they are providing a proper training with meditation and spiritual science, and so that it's fostering healthy, happy individuals in their life. So that's why so far we are trying to creating an environment. Apart from that, the today's presentation, like the medical diagnosis, is early happening, so that reducing the cost of the whole area, we are reducing all kinds of unwanted efforts. Similarly, here also we need to identify the potential people and we have to give them the spiritual training. So thank you. Thank you very much for giving this opportunity to give this presentation. Yeah.